the benefits from our grant as well as some of their initiatives. To do some introductions here, Sheila Olk-Martin worked in traditional healthcare operations as an administrator for 30+ years prior to joining Specialty Care Free Clinic last fall as their executive director. She has a master's degree in public health and a passion for assuring those most vulnerable in the community have access to healthcare. JoAnne McCann is a registered nurse and worked at UW Health Ophthalmology and other specialty clinics for many years before retiring 5 years ago and joining Specialty Care Free Clinic as a nurse volunteer and a board member. Right? Please welcome Sheila and JoAnne.
I can drive if I can from here.
That's fine. Okay. Do that.
Use my little arrows. All right. Arrows are good. Hi, everybody. Thank you so much for having us here today. My name is Sheila Martin, as I was introduced. I'm delighted to be the executive director for Specialty Care Free Clinic. It's a passion of mine and has been throughout my healthcare journey. As a long-term board member once said during my orientation, there is so much exceptional work going on here in this clinic, but like nobody knows that we're out there. Like nobody knows what it's about. And so she said, we're like the best kept secret around. And I thought, well, you know what? That's probably something I should do something about as the executive director. So imagine this. Imagine yourself relocated to Wisconsin, possibly from another country, probably with very few resources, maybe with limited English skills, and trying to get yourself set up and on your feet. Unexpectedly, your health deteriorates and you find yourself in a situation where you have no insurance. So imagine that. You have no health insurance, either because your employer doesn't offer it, or you can't afford it because health insurance is super expensive once you toss in all the co-insurance and co-pays. Or your citizenship possibly precludes it. And that is exactly what happened to Juan. This is a quote actually directly from one of our patients who wasn't Juan. We HIPAA'd him so that he's someone else, but a different name, but the same quote. I was in so much pain, I could hardly get out of bed, let alone work. Never in my life have I been without medical insurance. I didn't know what I was going to do. I was so grateful for your clinic and so thankful. What you provide to the community is so wonderful. Like 77% of our patients, Juan's preferred language is Spanish, and through one of our interpreters, he shared that with us. He is one of the 408,000 people uninsured living within Wisconsin. That's a really huge number. I think it's about 160,000 that had it not at all throughout the last year on record, and 408 didn't have it during parts of that year. That's a really huge number of people. Don't ever take it for granted. If you have health insurance, don't ever take it for granted. While low-income uninsured patients typically have access to primary care-free clinics at local primary care-free clinics, many patients have chronic and complex medical conditions requiring the services of a specialist, a medical specialist. And sadly, many uninsured patients don't seek care until they're really, really sick. Sometimes they end up in the ER. Sometimes they end up just not being treated for a very, very long period of time. So their disease is often really advanced by the time that they find our clinic and are referred in, and it can have a really significant impact on their health. So this is a picture of our little clinic. It is not a huge clinic, but it serves our needs very well. We recently moved just down a couple of blocks to Emil Street. We had been out in Middleton, and we just recently moved to Emil Street in this beautiful new facility. It's new to us facility. Specialty Care Free Clinic was founded in 2001 by 3 medical specialist physicians in the community who recognized that there's a huge disparity in the patients that they were seeing in their practice between the ones who had insurance and the ones who did not, just in terms of health outcomes and when they sought care and how manageable their disease was. While there are other primary care free clinics that are scattered throughout South Central Wisconsin, Specialty Care Free Clinic is the only one that serves specialty care. to low-income uninsured patients, helping them become a vibrant part of our community. So while Wisconsin Badger Care Plus insurance, they do offer insurance coverage to a lot of low-income people in our community, and some of you may have heard about that. It's not available to anyone and everyone, and some people do definitely fall through the cracks. Others fall into the gap where they make too much money for them to qualify for Badger Care, but they don't necessarily make enough to pay health insurance premiums. If you've ever been out on the .gov site and looked at what health insurance premiums actually cost, it is astronomically crazy. I had the opportunity to go out there not so long ago and take a peek at some of those, and between that and the deductibles, some of the deductibles are as high as like $7,000 per person. I mean, people who have no money or very little money and no insurance are going to have to struggle with that. While you can sometimes get subsidies for the premiums, they don't cover the subsidies for the deductibles and the co-pays and the co-insurances. Complex healthcare system we have. Still others are completely ineligible for Badger Care because they are not U.S. citizens, some of them, and so they're not eligible at all. Those are the folks, though, that are making up the backbone of the Wisconsin workforce in the dairy farming, construction, hospitality industries. They're out there doing that work for all of us on behalf of all of us. And at Specialty Care Free Clinic, we believe that access to healthcare is a human right. It's something that everyone ought to have. And a part of holistic healthcare plan is specialty care. So we've assembled a really caring community of about 90 volunteers. It's 45 physician volunteers that come from over 20 specialties, including like cardiology, gynecology, neurology, ophthalmology, psychiatry, surgery, urology. I could list them all, but that gives you a good flavor for some of the medical specialists that volunteer their time to come to the clinic. In addition to those physician volunteers, we have a lot of physician extenders, nurse practitioners, physician assistants. We have a lot of nurses, of which JoAnne is one, but we have others. And we have people who are called PCAs, who we sort of made that title so that we would have access to CNAs and medical assistants, and EMTs can come volunteer there. And it really broadened our base of volunteer clinical support to help our physicians. And in addition to those folks, we have volunteer interpreters because, as I said, 77% of our people speak Spanish, of our patients. And so we have medical interpreters that do all kinds of fabulous work with everything from scheduling appointments to helping interpret medical symptoms for a physician who may not speak Spanish, and then helping reverse that translation and helping patients understand what it is their doctor is thinking about their condition, what the plan would be, helping them arrange follow-up services, diagnostic services, things like that. Really makes a huge difference. Our clinic does employ 5 part-time people. And while a lot of our other people are volunteers, we do incur costs for rent. We do pay some medical interpreters because it's really hard to come by enough to meet our need. We have IT expenses. We have insurance, our own insurance expenses for medical malpractice type coverage and things like that. We have medical supplies and equipment that we pay for. And we receive 0 funding from any government payers or any government contracts. All of our funding comes from local foundations, local businesses, organizations like this, and from individuals within our community. So pretty amazing how many people support us. And here's how it works. It's pretty simple from a patient perspective. Patient gets a referral from a primary care free clinic or any other primary care source in the community throughout South Central Wisconsin. We do pull on 12 counties around the Madison area, but by far the majority of our referrals come from Dane County. I think because we're located here, transportation can be a challenge for a lot of people getting from farther out. But we do serve patients from the entire South Central Wisconsin area. We work with patients to schedule a time that's convenient for them and convenient for the provider that they're going to see, and they get the healthcare that they need. For the patient, it's about that easy. If they need diagnostic services, we do partner with a lot of collaborators in the community, and we do arrange that they can get medical imaging, pathology, lab services, things that we might need in order to solidify a diagnosis for them and a treatment plan. And we get those in kind by local healthcare organizations, UW Health and SSM. And we also partner with St. Vincent de Paul. And I know some of you in this room are familiar with St. Vincent de Paul. They have a prescription drug service, and we do partner with them and make sure that our patients get the medications that they need at no cost to them, so that they're able to get started on a treatment plan and receive the help that they need. If they require procedures and surgeries, we do work with local healthcare systems to make sure that they are assessed for financial, ability to pay, and they get deeply, deeply discounted services for those surgeries and other procedures that might be out of the scope of our clinic. We're just a little clinic that operates, during the week. And so we want to be sure that they have the backup of really big systems if they have really, really big things like that. So to a person, those who are affiliated with Specialty Care Free Clinic are all in on the mission of providing specialty health care to the uninsured low-income patients. In 2022, we provided 1,400 visits for people. And if I just pulled up our June year-to-date numbers, and we're on track to do 1630 or 1640, I think, if we finish the year in the same way. The need is not going away. The need is only going up. We do anticipate that as people are reassessed for their eligibility for Badger Care, that's going to start happening in the later part of this year within our state, that there will be people who have been kept on Badger Care throughout the pandemic because they didn't remove people, and that some of those people will no longer be eligible, and they will also fall into the pool of uninsured low-income people. So we do anticipate that this number is only going to continue going up. We are amazingly blessed with skilled and dedicated volunteers in our organization, as well as extraordinary donors. We couldn't do anything that we do without them. We really appreciate your interest in learning more about SCFC. And our hope after the presentation is that you too will help us get it out in the community, that we not be the best kept secret around for times to come. And with that, I'm actually going to turn it over to JoAnne, but JoAnne's not standing, I don't think. She has a boot on her leg, so I booted. Yeah, she can share a little bit about what.
If you want, JoAnne, could you?
Oh, sure. This is fine.
This can pull something
I
down.
promise I won't.
Don't fall off.
So Sheila asked me to speak to you about why I volunteer and why I enjoy it so much. And for a little shy of 40 years, I worked at UW Hospital. And I always assumed when I would look at their reports that everyone was, they write off so much community care that you'd think that everyone would be taken care of. But there's a huge hole in that, and in the surrounding area, in the state. And it's the middle care. So there's primary care with all the free clinics, access all the free clinics. And they're not free. They take certain insurances and that type of thing, and look at people's net worth. And then there's the hospital side of it. The hospital with surgeries or procedures or whatever that will see these patients, but they have to walk in, be able to speak good English, and sign on the dotted line that if they're able to pay, they will, which terrifies some of these people because they can't, and we're totally free. So how do we do that? Well, pretty much it's volunteer. So all the physicians that don't go well and retire or have gone on missions and really enjoy it, or just want to give back, or realize that there's people out there that really need their help, will come and volunteer. And it's like Old Home Week for the retired nurses from UW. Honest, Mark Hansen was the first. I'm really old. Mark Hansen was the first med flight nurse there. Everybody's there. When I didn't come until after I had retired, but when I looked at the eye lane equipment, I was like, by golly, I ordered that like 25 years ago, and somehow it ended up here. And I was like, holy smoke, I can use that piece of equipment. So even the interpreters are incredible. I mean, we have the woman that takes organizes and takes care of all the interpreters is one of the main interpreters at UW Hospital. And she's on call for like when people, when their son passes away or whatever, she's that Spanish interpreter. They will call her up to come and tell the family. I mean, she's really excellent. And she came to this country not speaking English, and this is her way to give back. She works part-time with us and makes sure that, because it's not easy to interpret for medical procedures, make sure that everyone's qualified. The nurses, a lot of them ran huge clinics, and they're happy to, throw in their 2 cents or work extra or whatever. Even our supplies. I know some of the providers still practice, certainly, and we'll say, well, we can't afford $100 a crack for that, and we can't for whatever they need, and they'll just bring it in. It gets donated from there, but these just the patients are incredibly grateful, and I'm incredibly grateful to work with them. I'll give you some example of a few patients. So we had, I can't say older because she's quite younger than I am, a very nice woman who was a grandmother, probably in her late 50s, had headaches and some numbness and tingling in one arm. And she had been through all the primary care clinics here that referred to us, and her blood pressure, of course, was sky high. And everyone decided that she was probably ready to have a stroke. I mean, these are the types of patients that walk in our clinic. It's not the regular run of the mill. And I sat down and talked to her to make sure when she left, I said, because they gave her medication, increased her medication, gave her all the phone numbers. But I think it takes someone to sit down and hold someone's hand and say, you know what? If you have any symptoms, and I'm talking any symptoms, you call 911 and you tell them to take you to UW Hospital because they have a stroke team. And you'll be scanned and taken care of within 15 minutes. Well, she had to call 911 a couple days later. And about 3 weeks later, she came in and she was fine. And she was so thankful that someone had taken the time to go over just the little things with her. And the physicians had taken the time, to prescribe the right medication. Sometimes you just can't stop something. We see a lot of, we have 2 or 3 neurologists. And I mean, they're the best in Madison. And we see a lot of seizure, younger people with seizures, because they've been diagnosed either in their home country or, I mean, if you went to your PCP and you were having seizures every other day, they would try different medications, but they're not neurologists, and Doug Dooley is great. I mean, he's one of, Madison's great neurologists, seems to always prescribe the right thing. It's just amazing, changes their medication, gets their whole history, changes their medication, does the scan. The patients go home, they come back, and they're free of seizures. And it's like, my God, this person can actually live a normal life. And these are fairly young people. I mean, they're all under 30, and there's a lot of them. And it's mind boggling. What else do we see? Oh, GYN, holy smokes. You'd think, how big of a deal could that be? You can't believe how many women have cervical cancer. I mean, it's like a revolving door. And I'm like, holy cow. And this is what our GYN people see. I mean, they don't see other piddly things. Trust me. We've got a nephrologist. The last time she was in, she had 2 patients. One of them went directly to UW Hospital to get put on the transplant list because they were that bad. And the other one had to go on dialysis. Even little things like blood pressure medication. You say to these people, you say to them, you have to take this medication for the rest of your life. So they can't afford it and they feel better and they stop. And they come in and their blood pressure is like, 220 over 100. And you're like, holy cow, how long have you been walking around like this? And they're like, well, I felt better and I didn't think I had to take it anymore. I thought I thought I was better. The medicine doesn't fix you. And so much of it is education. But these are the kinds of patients we see every day. I mean, it blows me away, seriously. The diabetics. Wow. I think anything that doesn't show, that you're not limping, you're not bleeding, you're not in terrible pain, they think they'll let it go because they can't afford to spend the money on that. And diabetes is a huge issue with Hispanic populations and diabetic retinopathy. People come in and they're practically blind because their blood sugars have been so out of whack for so long. And our care is free. And when we tell people our care is free, they can't believe it. But somehow we managed to, I can remember way back when I first started there, we were bringing pens in from home, for God's sake, because, we weren't going to spend the money on pens. We were going to spend it on patient supplies. So, yeah, it does. I mean, everything's for the patient. How do you make decisions? Well, the first thing is what's best for the patient. And if you don't have the money, you don't spend it on other things anyway. So, and what do I get out of it? A lot. So we had a patient not that long ago. I don't think I was having a particularly down day, but I wasn't, totally peppy. And this guy walked in and he had stage 4 cancer. He had tumors all over. He was emaciated. He looked terrible. He was also in congestive heart failure. And so he saw our cardiologist. And I thought, really? And he was so pleasant, so happy to be seen, so kind to everyone, making sure that he thanked everyone in the entire place. And that's how our patients are. They are so appreciative of any little thing you do. And our physicians, it's not unusual for them, because we're not open every day, to give out their personal phone number and say, and if you're having problems with this medication or whatever, call me. And they give out their own phone number. You can't not, I don't know. It's a great place to be associated with. And if anyone would ever like a tour, we're very small, but we cram a lot into our space. I'll tell you what, everything, is multi-use. We'd be happy to show you our corner, seriously.
So yeah, I was just going to ask, do you have some questions for us? How long does it take? Do they make appointments? Do they walk in? No, they can't walk in because we're not open every day of the week, number one. And number two, they need a referral from a primary care source who's kind of their base for managing ongoing care. A lot of our physicians, because a lot of them, 40% of our physicians are still practicing in their practices, and the other 60% are retired. So they're not always there for the continuity that you would want if we were to assume that care. So they come in by a referral from a primary care source who kind of manages the plan that we set up for them. They come in, we get all their diagnostics, we get
any other information that we need from the patient and from the primary care source. We set them up an appointment, we call them. Actually, we get the referral from primary care. We call the patient with our interpreter if we need to. And we find a time that works for them when that type of physician will be in again.
So they've gone to a clinic or they've gone someplace
Yeah.
before that.
Yeah, and part of the reason we do it is, like I said, we're not open every day, all day. So, you know, they couldn't just walk to our clinic and open the door and we might not be there. We also don't have nurse triage. We just don't have that level of infrastructure like a traditional clinic would have. Because we're on a skinny down budget, I would call it. And so their primary care clinic has that kind of infrastructure. So if they ran into a really significant problem, they could call. And everything we do, we fax all of our notes and our plans as a fax to PCP, so they know what's going on with that patient too. So we can collaborate on that care. Yeah,
It works, I'm sorry, I was gonna say, it works just the same way as if you would go to your clinic. If you had insurance and you go to your PCP and you say, I hurt my foot.
If they don't have insurance.
they go to a
probably not
free
going to
clinic.
go.
They do go to a free, there are free clinics all over
Right.
the community.
Primary. Are
The
they
community
involved?
health, yeah. There are several. They actually have them, interestingly, in all of the 12 counties that we serve around, even Dane and around. They all have free clinics in them, but they're all primary care.
Like, which ones, name some free clinics.
The biggest one is Access Community Health Center. And they take insurance and they also take patients that don't have insurance and they will treat them for free.
So they're
That's the
non-profit.
biggest one in our referral, easily. That's our biggest referring source when they run into things that are beyond the scope of primary care. They know they can refer to us.
How do you screen for eligibility?
The primary care screen them for eligibility. We do not have staff that screen them. So the primary free clinics all screen, and they have different levels. Usually it's 200, 300, 400% of the poverty level is what they go by. And they're all a little bit different, but not very much. So they do that screening and they make sure that they're not eligible for any other insurance. Because sometimes people are eligible, they just don't know they're eligible for like Badger Care or something. And so those primary care clinics do that work.
We had a student at Horizon High School that had an incredible, turned out infection in her gums and ended up having to have oral surgery. And we had a difficult time trying, of course, there's no insurance, trying to find out where we could take her and what we could do to do this. And it was over $10,000. And so I think, I'm trying to think that I think Action might have been one.
Access does have dental care. I don't know if they have oral surgery, but I do know that they have a dental clinic and they have a mobile dental clinic, actually. If that's sort of a primary service to do prophylaxis and cleaning and sealants and things like that. Yeah.
How many referrals do you get from emergency care? I've had 20 years or more of experience with renters who are low income. And, you know, they would just go to emergency care because they didn't have a PCP.
Well, and we do get some that go to the emergency care. I mean, because there are enough free clinics around, you know, we try, if we get a call from somebody who says, I think I have a problem, blah, 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 we refer them and set them up with a primary care physician. Because really for ongoing sustainable results, most of them need a primary care physician to manage the multiple things that they have going on. We can provide them a consultation, we do some procedures. You know, we can do ongoing stabilization and get them on a medication and get them stabilized, but we're really not set up to do ongoing care forever and ever for them.
You would take them as a referral from an emergency care physician.
Yeah, we do. We have some that come to us from that. Actually, usually the emergency care people though will get them set up with a PCP.
What about medications? I mean, a lot of medications, you know, diabetes and, you know, and all kinds of other things for stroke and heart failure are expensive.
Yeah.
So
St.
going on,
Benny, St. Vincent de Paul, here on Park Street actually really helps a lot with that.
And Access has a pharmacy that,
access is
really discounted.
Another one of our grantees, and that's been in existence for about, it's about 6 years, nothing.
Which one?
Same thing as special pharmacy, that's been open forever.
Yeah.
I don't know.
so it's discounted, but not free.
No, St. Vincent, they do a lot of free prescriptions actually. And
They do.
interestingly, I went and did a sort of meet and greet just to get to know them a little better as part of my onboarding. And they have a wide range of medications that they get access to. And they work with pharmaceutical companies to get deeply discounted or free meds also given to them. They have a huge program and they can get access even to like biologics and some of those very high end, medications that patients need.
But you have to have a pharmacist, and we don't have a pharmacist, so we don't.
We don't dispense.
You look for women who are pregnant?
We don't.
No.
We don't. We do GYN and we see a lot, as JoAnne was saying, we see a lot of people who have not had a pap smear maybe forever. And so we're diagnosing a lot of cancer. We partner actually with Share the Health, which is a women's health GYN. It's a group of GYN physicians who now they come and share our space and our staff. They're a separate organization, but we've kind of partnered together because we have similar needs. Yeah.
Sorry for being in here late, if we answered this. What, do you work with the crisis team now, what the name of it is?
The CARES team.
Yeah. Do you ever get involved with that or not directly because they have to go somewhere?
Not directly. I think if they run into somebody who's in significant crisis, they're probably bringing them to the ER or somewhere else to get them managed, or Journey Mental Health handles a whole lot of that type of patient need. We do have a psychiatrist and a nurse practitioner who can prescribe psychiatric meds. And I was talking actually to the psychiatrist that volunteers with us. And he said, some of my biggest success stories and that really feel like I make a difference is when I can get somebody stabilized on a psychiatric med, and then they become stable enough that they can go back and work. And then they get insurance. And then they don't have to see me here again because they come see me in my real practice. And that makes more access for people who need more help, you know what I mean, and are in that same situation. I thought, that's a beautiful testimonial to the kind of things that happen in the community.
We have a fair number of abused women. And that's not what they come in for. And our interpreters are wonderful. They really are. And they will find it out and speak with the woman. And then they get counseling. But it's not always apparent.
We are frequently, referring people to other services like
social work,
and food pantries and things like that, because, medical care is one piece of health, but there are so many other aspects that go into keeping somebody healthy.
We would get, I do at it anyway. Sorry, I get so excited about, if we only had this person, if we only had access to a social worker part-time, if we only had this. But it's hard to find those people to volunteer.
Consistently.
Yeah, consistently. And so, I think that we're a whole lot better coming out of the basement at Harbor.
That's what we used to have. Our
Right.
clinic.
And we worked really hard to get what we have. And we do have a beautiful clinic. We really do. And we put it together on a song and a prayer and a budget, looking for furniture and everything. It was really fun. And we have beautiful murals. We got someone to donate beautiful mural that we have on our wall. But I can see where there would be so many other things we could do if we just had a little bit more. Yeah.
You have another question?
I had two questions. Sorry, answered about the psychiatric care. A lot of the difficulties with that, I think, is people getting to a clinic. Do you have a system for transportation for people as well?
It's a super good question. We belong to an organization called WAFC, Wisconsin Association for Free and Charitable Clinics. And WAFC is working on a program with, I think it's with like Uber type transportation. They don't have it quite set up yet, but we've expressed interest in being a part of that. We really love our new location, actually on Emil Street, because it's centrally located kind of between East and West, and it's right off the bus route. So we know that that can help people also get to clinics. A lot of people are coming in with family members, you know what I mean? And so that's how most people are coming in, but no, we don't have a transportation problem or transportation program at this time. That's another thing that's sort of on the wish list for things we we could do. But you know, you have to just sort of take it a step at a time. And making sure we're not the best kept secret around is part of that. Yeah,
So you guys do minor outpatient procedures, and then if it's, you know, any surgery, you refer to the hospital?
yes.
Or-
So we're doing things like carpal tunnel release. We have a local anesthetic where we have a physician who will insert a steel thread into someone's hand and break the adhesions. Basically, it allows them to get back to work quicker. It's done with just a local anesthetic, seems to work really well. The demand for that is exceptionally high. A lot of our folks work in repetitive use type situations. And so, you know, carpal tunnel is a pretty common complaint. We're doing colposcopies and leaps, which are GYN procedures, and we do those in the office.
We inject a lot of, joints.
Oh, yeah,
We have
joint injections for orthopedics.
orthopedics.
People have a lot of back problems and knee problems.
We have 7 physical therapists,
Yeah,
and they're always busy.
yeah, they are always busy.
Mhm.
How often are you?
We're open Tuesday, Wednesday, and Thursday right now, all day. We are, because the visit volume continues to rise, so the need is not, we're concerned that we probably will need to open at least another half day and maybe another day of the week. We do it based on volume because to add additional staff costs additional money. So we're trying to max out those 3 days and make them as long as we possibly can before we expand into new days. We just started, we always thought all children were covered under Badger Care because that's what we've been told. And the reality is we've had a number of requests for us to see children more recently within the last year or so. We have expanded to taking referrals from 14 to 18-year-olds, not little peds, but big peds, because they're much like adults. I mean, if you have an orthopedic injury for a 15-year-old, it's pretty much the same as a 20-year-old or, you know what I mean? It's not that much different. There are a lot of diseases that are child specific and medication doses that would be child specific that a lot of our current doctors are all adult doctors. So we wouldn't be the appropriate place for children for everything, but we are definitely willing to screen the kids and make sure if it's an appropriate diagnosis and we can safely see them, we're happy to do that.
Do you have OTs on staff? Regional therapists?
No, but we love one.
I found one. I heard that. Why, you know another one? Refer them in. Well, we'd be happy to.
I'll talk to you afterwards.
Okay.
The second part of this, do you have to, for those of you that are licensed as an RN, do you have to keep your licensing, all that up?
Yeah,
all
You
that
have to be licensed.
In order to be covered by insurance. The insurance for licensed nurses or anyone that's physicians or anyone that's licensed is covered by state of Wisconsin.
Statute, the
Right.
Good Samaritan statute.
Right.
Got it.
But for the rest of our people, because we didn't have enough people to check in, we came up with a patient care assistant and we paid for theirs.
And that insurance policy costs $5,000 a year. I mean,
Nothing.
nothing's cheap, but you know what I mean? It was definitely necessary and we needed it in order to care for our patients appropriately. Yeah. Any other questions? I would offer, you did a really nice tea in Gray about the Delta Beer Lab. Guess who's following you? Yes, we're going to be there in August. So after you go and figure out what a cool place it is in July with Gray's organization, we would welcome you to come to Delta Beer Lab in August and enjoy the patio, and those tips will come and support the program.
Hopefully you're sure to get.
You know what? I'm sure I'm going to be there in July because I'm meeting with those folks here in the near future.
And Sheila's our first executive director. I mean, we really are growing. We had just a handful of people, and decided that we just needed more structure, more substance, more,
Gotta get the word out.
yeah. I mean, we were really tiny in Middleton. And so we're so excited to have an executive director, and the board members have all been doing all of, we've been splitting the stuff up amongst ourselves, and we're getting older, and she's much better.
I'm learning quickly. Anyway, thank you so much for your attention, for your interest in the clinic. Really, really appreciate it.
Thank you, both Sheila and JoAnne, for being here today. For all of our speakers, we make a contribution to the Rotary International's End Polio Plus Fund. We'll do the same in your honor as well. Next week, we have Brian Mason from the University of Wisconsin will be here to talk to us about name, image, and likeness and its impact on the UW student athletes. Thank you, everybody, for being present in person and on Zoom as well today. And remember, service above self. Have a great Rotary week, everybody.